Hello everyone, in this lecture we are going to discuss about the antiviral drugs part 2. In this lecture we are going to discuss about the HIV virus and then we will discuss how to treat this HIV disease or AIDS. So let us start with the nature of HIV, human immunodeficiency virus. This is a retrovirus, therefore it is different with other viruses. How it is attacking the body? So, human immunodeficiency virus, it enters or attacks the CD4 cells. Yes, these are generally the white blood cells or also known as T cells. Yes, they are entering the cell after fusion of viral GP41. Yes, this is the glycoprotein with there are two types of co-receptor, CCR5 and CXCR4. CCR5 co-receptors are present on the monocytes, dendrites, macrophages and other T cells. Yes. CXCR4 is generally present on the T cells. Yes. Now, after the fusion, there will be the viral RNA is converted to the DNA. Yes. So, the content which is present in the HIV virus is in the form of RNA. Yes. Now, this RNA will convert to the DNA by the help of reverse transcriptase enzyme. This is the enzyme. Yes. What happened after that? The viral DNA, when it is formed, it starts to integrate with the human DNA. Therefore, one product is formed, integrated product. Yes, with the help of one enzyme called as integrase. After that, what would happen? There will be the formation of proteins. So, this proviral DNA can replicate and undergoes the transcription to form RNA, which is further forming the proteins. Yes. Now, these proteins which are formed initially, they are in inactive condition. Yes. So, it need to change into active form by one of the enzyme protease. Yes. Once the functional proteins are formed, they will form new virion particles. Yes. So, see, the complete virus is generated from these of the components, means the proteins which are formed, functional proteins, which leaves the CD4 cells and then infect the other cells. So, this is the how the infection will spread to the other cells. Now, we will see one of the diagram, whatever we have discussed, the same is represented here. So, we can see this is the HIV, human immunodeficiency virus, which is containing the RNA genome. And there is one enzyme present, reverse transcriptase, which is helping for the conversion of RNA to DNA. There are at the envelope side of the HIV, we have seen viral envelope proteins. Yes, these are the proteins. So, these proteins will bind to the cell. Here we can see now it is attaching to the cell. Yes, T cell. There is first site, the first protein is attaching with the CD4 site. Yes. So, here we can see in this diagram. Then there are co-receptors present, either it is CCR5 or CXCR4. Yes. Then after the binding of these with the receptor as well as with the co-receptor with any one of them, what happened? This virus will introduce inside the cell and will release the content. So, the content is here the RNA. Now, there will be the enzyme reverse transcriptase, it will form the double stranded DNA or the copy of viral RNA. This DNA which is formed, it will integrate with the human DNA and the component which is formed is known as integrated double stranded viral DNA. Yes. Then further it will undergo the translation procedure where the proteins are formed. Now, we can see these proteins. after the proteins which are formed and the conversion of inactive to active proteins with the help of protease enzyme, the viral assembly procedure will start. So, here we can see the new viruses will form and these viruses will come out of the cell. So, new viruses, they are infecting the other cells. Yes, I hope this is clear to all of you. Now, on the basis of these steps, there are the drugs which are acting on the specific steps. So, now we will see, this is the pathogenesis of HIV and target of various drugs. We are seeing here, first this is the virus here and there is a glycoprotein 41. This is one of the protein, okay, which is present in this virus envelope. Now, this area is the receptor area or co-receptor area. Okay. There are two drugs, enfuvetide and maraviroc. These two drugs are acting as entry inhibitors. Okay. So, they will inhibit the fusion of the HIV to the T cell. Yes. Now, we will see in the next step where the virus is entering in the cell and viral RNA is introduced inside the cell, and there is a step called as a reverse transcription where the viral RNA is converted to the viral DNA. So, there are drugs under the category of NRTI and NNRTI, nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors. They are inhibiting this reverse transcriptase enzyme, so that this procedure will not happen. Viral DNA will not convert to viral RNA will not convert to viral DNA. The second step we are seeing here, after the formation of viral DNA, it is integrated with the human DNA. Yes, so this blue color structure we are seeing is a human DNA and this black color structure is a viral DNA. So, we are seeing one enzyme integrase and it is forming an integrated product. So, both of the DNA are joined here. Okay. So, there is one drug category under which there is raltegravir and elvitegravir. This is the integrase inhibitors. So, they will inhibit this integrase enzyme, so that the viral DNA cannot join with the human DNA, it will not integrate with this human DNA. So, this product will not form. Okay. Then there are another step, we will see another step. So, the integrated product which is forming the RNA and the RNA which is forming the proteins. Yes, initial the proteins which are formed, they are long chain. Okay. And these long chain proteins are inactive. Yes, we need to change it into a short chain which is the active proteins. Now, how this happens in the cell is by the help of protease enzyme. This will cut the chains of the protein, long chain of proteins, and will form some functional protein. So, here there is a protease inhibitors which is used in the treatment of HIV. These protease inhibitors will inhibit this enzyme for this conversion. Okay. Ultimately, of course, new viral particles will not form and they will not spread the infection to the other cells. So, these are some of the steps where the drugs can target. Okay. I hope this is clear to all of you. Then we will see the classification here. So, this is the anti-HIV drugs. Now, RTI, reverse transcriptase inhibitors, they are classified on the basis of on the basis of action they are performing, competitively or non-competitively. Yes. First is nucleoside reverse transcriptase inhibitor. Under this we have a nucleoside or nucleotide. Okay. In nucleotide we have already the phosphorylated group, whereas nucleoside it need to change by kinases enzyme into phosphorylation reaction. Okay. So, zidovudine, stavudine, lamivudine, zelcitabine, didanosine, abacavir, emtricitabine. These are the drugs under nucleoside, reverse transcriptase inhibitor. Under the nucleotide, tenofovir. Then we have non-nucleoside reverse transcriptase inhibitor. Okay. Under this, we have efavirenz, etravirine, nevirapine, delvirodine and rilpivirine. Then protease inhibitors. They are helping in the step where the inactive proteins are converted into inactive proteins are converted into active proteins. So, they are inhibiting that step. Okay. Sequinavir, ritonavir, indinavir, nelfinavir, eprinavir and fosemprenavir, lopinavir, darunavir, tipranavir. Now, entry inhibitor C. So, in the very initial I told you there are two drugs which inhibit the fusion of the virus to the T cell. So, enfuvetide and maraviroc. Then integrase inhibitor, there is one step where the viral DNA is profusing with the human DNA. So, drugs like reltegravir and alveltegravir, these are inhibiting the integrase enzyme. Now, we will see the reverse transcriptase inhibitors. So, reverse transcriptase inhibitors, they are inhibiting the reverse transcriptase enzyme. Yes. Now, HIV is different in nature with the other virus, it is a retrovirus. Yes. It is using RNA dependent DNA polymerase which is known as reverse transcriptase. Under this, there are two drugs which I told you initially. One is NRTI and another is NNRTI. Yes. NRTI, either it is a nucleotide or nucleoside, they are acting competitively. Their structure is very similar with a nucleotide. Yes. Whereas NNRTI, they are working as non-competitively. So, this is the basic difference between these two and the same is written here. Yes. So, competitive inhibitors may be nucleoside reverse transcriptase inhibitors, NRTIs, or nucleotide reverse transcriptase inhibitors like tenofovir. Yes. Whereas non-competitive inhibitors are known as NNRTIs. Now, see, NRTIs, all of the NRTIs, they are the prodrugs. Okay, they do not have the phosphate group, nucleoside. This is the basic difference between nucleoside and nucleotide. Nucleotide do not need to be activated, they already have the phosphorylated group. Yes, whereas nucleoside need to convert, need to activate it by host cell kinases and they convert it into triphosphate compounds. Yes, and then only they will show their action. Okay. So, they will inhibit reverse transcriptase enzyme and act as chain terminators. Yes, by incorporation into DNA chain. Yes, they are generally used in the combinational therapy because there are chances of resistance. Under this we have one drug zidovudine. Yes, zidovudine is very much used for the needle stick injury patients, okay, where we are transfusing the blood or we are using the needles at the time if there is an injury. Okay, so, there are chances that the patient will get the infection. So, for the prophylaxis of needle stick injury patients in those patients and also in preventing the transmission of HIV from mother to fetus, this drug is very popularly used. Yes. Now, what are the side effects of these drugs? So, it will cause megaloblastic anemia. So, immature RBCs are there in this disease. Yes. Neutropenia. So, WBC level, these levels will low. They are also affecting the platelets. Okay. So, the platelet level will also be low, thrombocytopenia. Now, another drug is didanosine. Its oral bioavailability will reduce by the food. So, this is one of the precaution. Yes. Now, what are the effects of these drugs? So, NRTIs, they are causing pancreatitis. Yes, they are causing hepatic disorders. They are causing lipid metabolism abnormality. Yes, because the fat distribution will not be proper. Yes, sugar, glucose metabolism will not be proper. So, these type of effects are seen with the nucleoside reverse transcriptase inhibitor. Yes, hyperuricemia, uric acid level will be high and it will also cause optic neuritis. There will be nerve damage in the eyes. Okay. They will also cause neuropathy, peripheral neuropathy, neurons damage. Yes, CNS effects will be seen here. Now, diarrhea is one of the more common problem with the didanosine than compared with other NRTI. So, these are some of the precautions here which need to be taken care while prescribing these medication or dispensing these medication. Another drug is a stavudine. Okay, this is also causing peripheral neuropathy. Not only this drug, all of the NRTIs, I told you, these nucleoside or nucleotide, they are causing peripheral neuropathy. Yes, maximum chances of lactic acidosis, increase of lactic acid levels. Yes, they are causing mitochondrial toxicity, that is why they are increasing these levels, lactic acid will increase. Yes, it also result in pancreatitis, the same effects we have seen in the previous drugs also. Yes, it is more strongly associated with lipodystrophy syndrome. I told you this is lipid metabolism is abnormal. Yes, distribution of fat is not proper. Then all NRTIs, they are excreted by the kidney except one drug is abacavir. Yes, abacavir is metabolized by one enzyme, alcohol dehydrogenase, and there are chances of hypersensitivity with this drug. Yes. Now coming to the nucleotide RTI. So under nucleotide means there is only one drug here. In the classification what we have discussed is tenofovir. Yes, this does not require the activation because its structure already have the phosphorylated group. Yes, it is excreted by the kidney and renal impairment including a Fanconi-like syndrome. There is one problem with this drug is it is causing Fanconi-like syndrome. What happened in this syndrome? In this syndrome there is the accumulation of glucose, yes, anions, there are some anions, sodium, amino acid, yes, they are accumulated inside the body due to impaired kidney function. Yes, and once they are accumulated inside the body, they will also seen in the urine. Yes, so it will cause hypophosphatemia. There will be one situation, hypophosphate levels will be low. Yes, so this is one of the condition we have seen with the tenofovir. Now oral bioavailability it will talk, so it will increase with the meals, it will take it with the food. Okay, it is well tolerated drug, but there is one problem, flatulence. Okay, gas formation is only one of the significant side effect. Yes, this is also one drug which is used for the treatment of hepatitis. Now coming to the NNRTIs. So non-nucleoside reverse transcriptase inhibitors, they are acting non-competitively. Yes, there are two type of virus, HIV-1 or HIV-2. Yes, so HIV-1 is predominant, means for more of the areas if we will see worldwide, so the number of cases with the HIV-1 is more. Okay, if we will see the USA or worldwide areas, 95% of cases are with HIV-1. HIV-2 is in some of the southern Asia region and Africa. There are some areas where we have also seen the HIV-2. Okay, in HIV-2 this is slowly progressed. So there are some differences with HIV-1 and HIV-2 depending on the number of cases on the basis of the sites we have seen here. Yes. Now if we will see the NNRTIs which are acting non-competitively, so they are acting on the site which is called as allosteric site, means it is different site with the NRTIs. Yes, these are selective for HIV-1, yes, and have no activity against the HIV-2. That's why I told you the difference here. Okay. Now resistance of these drugs develops very rapidly, that's why combination is prescribed. Yes, what are the drugs under this, like efavirenz, nevirapine, etravirine and delavidine. What is the side effect with this drug is the, see, there is a Stevens-Johnson syndrome. What is this? There is a skin rash. Okay, severe skin rashes will be there and toxic epidermal necrolysis. So there will be cell death also. Now, as I told you, in NRTI there is a one drug zidovudine which is used for the prevention of vertical transmission of HIV from mother to fetus. Similarly, nevirapine is also used for preventing the vertical transmission of HIV from mother to fetus. Yes, but there is one difference between these two drugs is zidovudine has nearly 21.5% efficacy, whereas nevirapine has nearly 13% efficacy. Yes, so it decreases the transmission to 13%. Now, there are other drugs like etravirine, yes, rilvapirine, these drugs are also used. Now, we have one advantage here with the NNRTIs, they do not cause lipodystrophy, which is caused by the NRTIs. Yes, nevirapine, efavirenz, they are also enzyme inducer, whereas if you will see the delavidine, they are enzyme inhibitor. So, there are chances of drug interaction with this category of drug, just because of their activity to either increase the levels of enzyme or decrease the levels of enzyme. So, we have to take precaution while we are prescribing these type of combination. After that, we have a protease inhibitors. Protease inhibitors, what they are doing? They are inhibiting the protease enzyme levels, which is essential for the maturation of infectious virions, okay, which is essential for the conversion of inactive proteins to the active or functional proteins. So, we will see oral bioavailability of indinavir. Indinavir is also one drug in the protease inhibitor. So, this is decreased by the foods. We have to take care here. Now, with the protease inhibitors, there is one problem. It will form crystalluria. There will be crystals formation. It can also cause the stone problems. Okay. So, whenever these drugs are prescribed, it is the prevention is taken care that good hydration, okay, water intake should be more. It should be maintained properly. Yes. Now, all of the protease inhibitors, they have the same type of side effects as with the NRTIs. They are also causing the metabolic abnormalities. There will be cholesterol levels will be high, okay, glucose metabolism will not be proper. So, diabetes mellitus, lipids level will be high, okay, insulin resistance will be there, fat distribution will be altered. So, lipodystrophy is seen with the protease also, okay, protease inhibitors. So, NRTI and protease inhibitors both have same type of adverse effect. Yes, they are causing lipodystrophy syndrome. Now, entry inhibitors. So, there are two drugs, enfuvetide and meraviroc. Okay. So, enfuvetide is binding to the GP41 subunit of HIV envelope protein and then inhibit the fusion of the virus to the host cell. Yes, there is one problem. It is given subcutaneously, but there are chances of hypersensitivity and it is also causing HIV. It is also causing pneumonia. Yes, it is not effective against HIV too. Now, coming to meraviroc. So, meraviroc is also a entry inhibitor. This drug is acting on CCR5 co-receptor. Okay. They are effective on those cells where this particular receptor is present, co-receptor is present. Yes. This type of HIV-1 virus tends to predominate early in infection. It can be given orally. So, drugs are available as oral form as well. Okay. Now, coming to the integrase inhibitor. So, like reltigravir, elveltigravir and dolutegravir, these drugs are under integrase inhibitors. What they are doing? They are inhibiting the viral DNA to integrate with the human DNA. Okay. So, the integrated product will not form and other function will not occur. Yes. There is one drug cobicistat which is approved. Approved for this combination. It is acting as boosting therapy. Yes, it is boosting the effect of elvitegravir. Yes, and it is also given with the darunavir, atazanavir. So, these are the drugs which are given in combination to boost the therapy. So, antiretroviral therapy ART, which is also known as highly active antiretroviral therapy, HART. Yes, and this is also known as CART, combinational antiretroviral therapy, which is used for the treatment of HIV infection. So, the primary goal is of complete suppression of viral replication. Our main goal for the viral load should be less than 50 copies per ml of the sample. Yes. So, here we are seeing the combinational therapy, and why this combinational therapy is preferred? Because there are chances of resistance if we are giving it alone. Okay. Now, WHO, World Health Organization 2010, NACO, National AIDS Control Organization, yes, this is a body of India, and in 2011 they have given some combination, and this is the US guideline. So, what is important for us is the NACO guideline. Yes, so we will see here. First line therapy is 2 NRTI plus 1 NNRTI. Yes. So, 2 drugs from nucleoside reverse transcriptase inhibitors. Yes, and 1 drug from non-nucleoside reverse transcriptase inhibitors. Now, what are the options? So, first drug, here we are seeing we have option either Z or S. What is Z? Zidovudine, and S is stavudine. Yes. So, any one drug we can give. So, this is the first. Second is L. L is the lamivudine. So, this is mandate to give. Yes. Then we will see EF/N. EF means efavirenz and N is nevirapine. So, we have the option in efavirenz and nevirapine. Okay. So, 3 drugs we will select here, 2 from NRTI and 1 from NNRTI. Now, prefer to start. What is our preference? So, our preference is first in Z and S we will select Z. L is mandate, means lamivudine, N is nevirapine. Yes. Now, if first line drug is not effective, at that time second line drug is preferred. So, what is the option? We have T. T is tenofovir. Yes. Then L. L is mandate, lamivudine, and the third drug here we are seeing, we have option with AT/LO. What is AT here? C. Atazanavir and ritonavir. This is one of the combination. This is also boosting therapy. Yes. Or the second option is LO, lopinavir or ritonavir. So, these are the combinations we are preferring in the National AIDS Control Organization by 2011. Okay. Other combinations are written here, the abbreviations are also written here. We can understand by this WHO and US guidelines. Thank you so much everyone. I hope this is clear to all of you about this HIV and the treatment guidelines under this.